Good evening, everyone. International Women's Day is celebrated annually on March 8th to pay honor to the great women of the society. The theme of this year's International Women's Day is Gender Equality Today for a Sustainable Tomorrow. Presence of a woman has such a strong impact in everyone's life, and taking care of their health is very crucial. We have our consultant Dr. Janani Iyer addressing on the major issues faced by women during early and mid 40s. Now I request Ms. Soumya Skandan, Director Community Services, Health of Rotary Club of Madras East, to deliver the welcome speech.
Hello. Are you able to hear me? Yes. Good evening, everyone. Welcome to the webinar on Women's Day, focusing on women's health issues. Something that is very relevant today for a lot of us is menopause, and we have Dr. Janani here, who's an expert and will be talking to us on key issues related to menopause, and will be helping, and we can ask her any questions that may be in our mind regarding how to deal with it, what would be the care that needs to be taken in that time. Thank you all for taking some time off and participating in this webinar, and thank you, Dr. Janani, for doing this session for us.
Thank you, Ms. Soumya. And now we will have a short video about Curi Hospital.
Welcome to Curi Hospitals, where robotics enhances a human touch. Established in 2018, Curie is located on OMR at Torrepakkam. Curi Hospital's design, built to NABH standards, is inspired not just by the need of its patients, but by the needs of their caregivers too. Which is why, as you walk into Curie, you will find every space ergonomically designed and environmentally inspired. A truly green experience. Curie is a 75-bed facility and one of Tamil Nadu's standalone single specialty hospitals for the treatment of renal diseases. What it means to be a single specialty hospital is that our expertise and focus never diverted. All our facilities and staff are focused, trained, and dedicated to a single purpose, so that we can deliver the best possible medical care for your needs. Our hospital is designed to cater to all social strata economically, so that no patient will be denied excellent medical care at the time of need. But as the saying goes, a hospital is only as good as its doctor's skills, which is why we are proud that we have specialists on board, singularly focused on our specialty, urology. To back up and support the skills of our specialists, Curie has the best cutting-edge technology available in all facilities, be it CT scans, ultrasound, urodynamics, dialysis, or just a simple X-ray, and of course, robotics. This ensures that every patient will get the best care with the best technology to back it up. Curie also has a plethora of the best qualified doctors who combine medical expertise with experience. What enhances this expertise is our new robotics technology, which adds a new dimension to assurance and reliability. Robotics in surgery increases outcome for the patients, taking care and eliminating even small factors like a hand tremor. Curie has invested heavily in this new age technology, and the results have been remarkable. With a commendable success rate, we are already heading towards being a reckoning force in urology in India. Now let's step back a minute and think. Technology and skills apart, a hospital has to be about being humane, which is why our CSR program supports and houses the Indian Prostate Cancer Foundation and the Dementia Daycare Center, with specially designed spaces for both a multi-cuisine canteen backed by inputs from our dietitians, and kiosks spread across every floor ensure patient comfort with a variety of food and caregivers. Curie is committed to ensuring total comfort and care for its and caregivers. Curie, integrity and commitment towards patient care, backed by teachers. Curie, with a human touch.
Now let's begin the awareness. Today we have Dr. Janani Iyer to talk about No Pause with Menopause. A brief introduction about her. Dr. Janani Iyer is a senior obstetrician and a gynecologist at Curi Hospital with an experience of 22 years in this field. She obtained her MBBS and MD in obstetrics and gynecology from Maharaja 𝐂𝐨𝐧𝐬𝐿 University and Medical College, Baroda. She has obtained CCG and FRCOG from UK, where she practiced for 14 years. She also did her training and research in subfertility at Newcastle University, UK. She was a former consultant in UK. Her areas of expertise are male and female subfertile treatments like ultrasound, laparoscopy, and assisted reproduction, including IVF, general and adolescent gynecological problems, high-risk obstetrics, and menopause. Over to you, Janani ma'am.
Thank you, Shreya, for that introduction. A very good evening to all of you. Today, I would like to thank Curi Hospital for giving me this opportunity. I would like to discuss a bit about menopause, but I feel that while I am talking, can you please keep your questions coming? Because it becomes easier to actually focus on what your specific questions are, while I will be giving you a little bit of information about menopause. Why is menopause such a big thing? Why do people really fear it? Is it something that comes suddenly? What are the issues that we are likely to face during this period, and how to tackle them? This is what is the general broad outline of my talk today. So menopause, how do you define this? Menopause is a condition when there is complete cessation of activities from the ovaries. As we all know, the female is, every woman is born with one uterus and two ovaries. These ovaries have got a finite set of eggs in them, which during the process of ovulation, every month one egg is released. At a time, slowly these eggs from the baskets get exhausted. And when there is complete cessation of ovarian activity, there is no more eggs left in the basket, that's when menopause hits. This is a gradual process, and exact definition of menopause is 1 year after cessation of periods. That is, usually the way menopause happens is there is some change in the period cycle, which for many women would be lengthening of the cycle, which is a normal 20-day cycle, would then go into say a 35 or 42, 2 months, 3 months, and when they do get periods, it is usually not as much as the normal flow. It would be a day or two, and slowly it becomes just a day and then just a wipe on the tissue, so on. And when there has been no periods at all for 1 year, that is when the woman can consider herself as being menopausal or attained the menopause. The other important thing here is once that period of year is over, after that, any bleeding is considered unscheduled and warrants further investigation. So, as I said before, there is a period which is perimenopause, leading up to menopause, and then post-menopause. So, this period is not something that comes overnight or is sudden. Therefore, there will be changes before menopause, which is considered to be perimenopausal changes. Now, these perimenopausal changes, what are they likely to be? Most frequently, when we see women, these are those who have problems with menstrual function. So this is most likely to will be presenting as heavy periods, altered frequency, that is the cycle. One cycle is 30 days, but from what I'm just reading the question that has been popped up, but at the same time, let me finish this. So what normally women will complain is that I've got a cycle which came after 45 days, but now suddenly I feel that it is now 10 days and the bleeding hasn't stopped. So that is one typical presentation of somebody being in the perimenopause period. So perimenopause, again, how long is it likely to last? It can last anywhere from 5 to 7 years. That is something which is unpredictable. However, if there is bleeding which is long and doesn't stop as routine 4 to 5 days of flow, then yes, you have to consult a gynecologist because that bleeding needs to be controlled. And coming to the question, somebody just asked one question here, which is, what is the typical age for women to stop having their periods? So now the thing is, we see that Asian women have menopause far sooner than the women of the West. For Asian women, anywhere between 47 to 52 is considered as the average age range to attain menopause. However, it is not uncommon that we have seen in India women have reached menopause even at 45. So, but again, that is early menopause. Therefore, the problems with menopause are likely to strike that particular woman sooner. And what could be the reason for a 52-year-old woman to have longer periods with 1 or 2 days of heavy periods and other days some light periods? Again, when we say about cessation of ovarian activity, I think I would like to compare it to something like a fused bulb. A bulb that is going to fuse does not just go, off just like that. It will start becoming a little bit dimmer at times. Sometimes it's a bit bright, and then suddenly it fuses. So you can think of the ovary as something like that. Then there is some activity, so you're likely to have a normal flow, and then there is not that much of an hormonal impulse, and therefore there will be the occasional period which is a little bit lesser than routine, and then again, so a stop-start flow or a heavy or a lighter force, they are all variations. However, it is within the copable capacity of somebody. That is, it's not too heavy, not too painful, not causing anemia, then it is still acceptable. Because again, see, we like to treat women medically, but we have to also accept the menopausal, changes that are occurring. Even if we treat, how long are we going to treat? At some point, if everything is normal, yes, there may be a decrease or increase in frequency. The cycle may become 21 days, but if in 21 days you only get a day's flow, that is still acceptable and one has to accept it. There are medications that you can take wherein you can lengthen the cycle, adjust the flow. All these things are there, but you cannot get away from menopause. So that's one. The second thing is, so what are the other features? What does menopause do to me? How will I know whether I'm going to go through menopause? So changes, estrogen is the wonder hormone. Why do girls, women all look pretty in their, the best of their periods of life, which is say, whatever, 20 to 45, and without doing much? Of course, now you can use cosmetic technology and, be very pretty even at 85, 90, all that is fine. This is all I'm talking about, actual appearances. But that is because of the wonder hormone estrogen. So, as far as, we talk about looks and estrogen and its role, it is also important to understand that estrogen has got so many good effects on a woman's health. Right from beautiful skin to shiny hair, it is very important to keep the heart in good place. It prevents the narrowing of the arteries. And again, we look at every system and there is a role of estrogen. So right from the cardiac system, that is why we always, we have noticed that it is men who typically have cardiac arrest and heart problems first. However, if you do come across heart problems in female, it is always post-menopause because that's when it equates for both of them. Similarly, if you look at other bodily systems, that is the bones. Again, strong bones, you hardly ever know of women who have fractures till the age of 50. But suddenly, when you have somebody who's 65, 70, they have a minor fall and they have fractures. That is because of the role of estrogen in keeping the bones healthy. Again, a lot of influence of estrogen goes into the circulatory system, and that is at the capillary level on the nervous system as well. So sleeplessness, hot flashes, memory loss, and when I say memory loss, it's like short-term memory loss, unable to recollect where you have kept the keys for your car, or unable to kind of remember numbers, or something's very common which you would be asking yourself, oh my God, 2 years ago I was so good with something, and now look at me, I'm like this. These are very typical symptoms that can happen with menopause. The other thing is about, what I mean to say is effects on the bladder. When you are into menopause, there is lack of estrogen support on the bladder. So the tendency to or the inability to hold urine for long periods, or once you have emptied, you feel that you want to go again. Again, similar feelings of dryness in the vagina. This is all because of the lack of estrogen. So similarly, when we have women who present with these findings, we see that we give a little bit of support with estrogen, and it seems to be a lot better. Now, the other thing that somebody has asked me here is dizziness and morning episodes of struggles, typical symptoms. Usually, a general feeling of fatigue and malaise. That is all we find that very commonly. People tend to feel tired very easily when they are going from into the menopause, or in the post-menopause. There is a general, feeling of comparison in women. They will always say, even if it's in pregnancy, they'll always compare last pregnancy, current pregnancy, and then say, they will look back and say, oh my God, I was working so well with my first, I was working till 36 weeks, but now I'm only 20 weeks pregnant, and I'm not able to do this. But what they forget is that the body does age, and we have to do certain things to keep up with this. And menopause is not really helpful in that, because it actually brings you further down. So you have to kind of then put in some coping abilities as to how you're going to maintain being what you are well into your late 60s or 70s. Also, you want to tell yourself, how am I going to be independent, even at an age where parents or anybody, we are in a generation where we do not want to be dependent on our children to look after us when we grow old. So it's all about preparation, and preparation only comes when you have a knowledge or an anticipation that, look, this problem is going to come. How am I going to tackle this? So again, one more thing about this awareness is, I'm trying to tell the women out there what it is that you can experience in menopause. It is about, telling yourself, look, this is going to come eventually. Not every lady will feel all the effects of menopause. Some people will not have hot flashes and, these kind of what we say vasomotor symptoms. Not everybody will have a bladder problem. Some people will just have vaginal dryness. Some people will not have any, interest or lack of libido, as we say, is noted. And some people will just commit tiredness or insomnia. I have seen a lot of women, say, once I go, get up from my sleep, say, to go to the toilet, I'm unable to go back to sleep again in the night. So that is quite classic to say, you are going you are going into proper menopause. Now, the other thing is, this is also, when I'm talking about menopause here, I'm talking about menopause which comes naturally. When we have somebody who has had a surgery, say for instance, you had a problem with bleeding, and you had some issues for which you required a hysterectomy, and the uterus was removed, is that considered menopause? When we remove it is considered menopause, because if there is no uterus, you're not going to have a period. However, whether the ovaries were removed or not is of utmost importance, because the uterus is just the end of it for the effects of the ovaries. So if the ovaries are still left behind, they will continue to secrete the estrogen hormone in your system, and you will not actually see the effects of menopause till the ovaries continue to naturally stop releasing the hormone. So people who have had hysterectomy, yes, there is data to say you will actually hit menopausal symptoms a bit sooner when compared to if you have had your uterus otherwise. So the average age of menopause after having the uterus removed can be anywhere between 5 to 7 years, or the natural age of menopause, whichever comes first. But if somebody has got, say, heavy periods at the age of 47, 48 and needs a hysterectomy, at that point in time, often many gynecologists will advise removal of the ovaries at the same time. Now, the thought process behind this is when we are going in to perform surgery, why don't we consider removal of the ovaries? Now, there are two schools of thought. There are people who will say the ovary looks normal, I'm not going to remove. But there are people who will say, look, if I remove the ovaries, then it saves me all the hassle that should something arise in the ovary later on, I don't have to go back in there. And also, if you remove the ovaries, it removes your background risk of 2% chances of developing ovarian cancer, which is the natural risk for anybody who has ovaries. So, which is why beyond the age of 45, 46, doctors will consider removal of the ovary along with the uterus. Now, the other effect, and perhaps the most important effect of the hormone estrogen, is the effect on bones. So, if you don't have to worry about anything else and everything is fine, you have got excellent capacity, or you never went through any of the symptoms of menopause, the only thing which is a silent disease is osteoporosis. And that is where one has to be really, really conscious of this and ask yourself, what is it that I can do to continue having good bones? Now, estrogen is a hormone that will prevent bone loss, which is why bones are maintained in good health till the time of menopause. After menopause, the rate of loss of bone is almost 20%. And therefore, you can imagine that how rapidly bone is going to become porous or weak. So osteoporosis is a condition wherein the bone density or your actual bulk of the bone has reduced, and therefore, if the bone framework has become very loose, with a little bit of insult to it, that is like a little fall, you can see that the bone becomes very fragile and it is more predisposed to fracturing itself. Then the question becomes is, oh my God, you've told me about so many things about menopause here. Should I be worried about it? What is it that I can do? So what are the things one can do to make it easier for your own self to go through this process? Once you know that you've started seeing alteration of cycles, and you know that you have started, the other thing is weight gain, that even though you have been exercising regularly, you are a very healthy person, you will see that you are actually putting on weight, and more so in the abdomen and thigh area. Typically, this is known as android obesity and is again one of the symptoms of manifestation of menopause changes, because with menopause, there is slowing down of the metabolism. So once these kind of things are noted, then you can assume that the perimenopause change has set in. And therefore, what is it that you can do once you realize you are in that particular phase? Most importantly, women should talk to their husbands, because one thing I have noted is that while the woman is suffering, majority of the women will come to me with vague symptoms that, all this is happening to me. I was never like this. What should I do? They do bring the husbands, but sometimes it feels as if the men are really not bothered. What I get told of many times is, she has always been like this, and they laugh it off, which is very, very wrong. So, see, this is a women's talk, but I really want you guys to go and speak to your husbands if you are in that particular age range, that this is something that is not in your hands. And it is quite classical to have irritability, mood swings, also cry at the smallest argument. And that is something because the mood is so labile with menopause. Yes, there are disputes in the family because of this alone, because men fail to understand women. They fail to understand that this is not, the normal wife anymore. She's undergoing these kind of changes. So if you tell them that this is what is supposed to happen and is happening to me, you can perhaps expect a lot more support from their end. That is one. Two, as I said, that often we cater, the treatments based on the symptoms that is most annoying or disturbing. For instance, if there is bleeding, which is bothersome or causing anemia, then usually, yes, we will investigate to rule out that there is no other pathology like a fibroid, endometriosis, so many other gynecological conditions which also can be bothersome in this particular age range. Then we would cater it. There are lots of hormones that we can supplement to make it easier on the women. Not, and also one more thing I'd like to stress is nowadays there are so many medical treatments available. Hysterectomy is really, really the very last resort for bleeding problems. So please don't think that if you have got menstrual issues during the perimenopause, then you have to just go and get your uterus removed. No, it is not like that anymore. The other thing is about weight gain. What can one do about weight gain? Often because the metabolism is slow, either you increase your metabolism, which is go for further increased exercise activity, and two, we will have to reduce what you eat. So decrease intake.
What you eat.
Important. You need to actually downsize your plate, cut down on your sweet tooth, increase the exercise activity. That is one more thing I need to tell you about at this point in time. Often most people will say, I walk every day. So yes, but what is the amount, distance that you're walking? It is not the time. Somebody could do 2 kilometers in 45 minutes. Somebody could walk 4 kilometers in 45 minutes. So often when I ask, they say, every day, madam, 1 hour nadakrena. So 1 hour, 2 kilometers, 1 hour, 6 kilometers, that is up to the person to decide. So it is more about distance and more about at least getting 150 minutes of really brisk exercising in 1 week. That is what is important. When you walk, you're only exercising your legs. What we do know about menopause is that there is muscle atrophy. So if you do lose weight, it is not at the cost of the muscle. It should be at the cost of, it should be loss of fat that you're looking. So while you may be very keen to lose weight, you must do strengthening exercises. And often, when you look at old women, all these parties, sometimes they'll have this hand and then, you look under the blouse, it is just a wobbling skin. That should not happen because that is what is muscle atrophy I'm talking about. You need to really do, and weight strengthening exercise is not about going to the gym. Just trying to lift 2 kilos and holding it up will also train your biceps. So it is that kind of activity that will keep up muscle bulk, and that is what is important. Again, dano poi walking பண்ணிட்டு வரல அர்த்தம் இல்ல, because you are only legs மாத்திரம் தான். You have to do yoga மாதிரி activities. I've been asked to mix Tamil and English. That is why my sudden switch to Tamil. So I'm just going by whatever chat messages I'm getting. So அதனால flexibility அது மாத்திரம், because bones வந்து ஒரு தடவை ஈரோட ஆச்சு, it becomes brittle. Stiffness வந்துரும். See, as the bone, when it loses its strength, it doesn't want to do that activity anymore. It is self-protective. அந்த cycle break பண்ணதுக்கு தான் you must start doing flexibility exercises. So simple things like Surya Namaskar, if you take that in yoga, it exercises so many muscles of the body. And that is what I'm actually talking about. ஒரு தடவை 5 kilometers நடந்து வரதுக்குள்ள try and do 10 Surya Namaskars in a day. It is going to give you equal amount of strength training. And that is what's important. If you are in the perimenopause, that is, 45 to 50, menopause varla, then you should, that is the best time that you will actually train your body. Appo pandra, step up of that exercise is really going to help you. Also, the other thing I want to say is, in the middle, see, when somebody is struggling a lot, with problems, then yes, I would always recommend estrogen supplementation. It is very easy. The logical sense being, body estrogen illa. Na estrogen or tablet akutena, people will feel, really good. And we have seen that. I have given hormone replacement therapy to many women who have been really struggling. Now, the idea of giving this, especially menopause நாற்பத்தஞ்சுக்கு முன்னாடியே வந்துருச்சுன்னா, you definitely need the hormones, because you are going to lose bone very quickly. So, அதனால we will put them for a little while. So, see, 2 years, 3 years, and slowly wean them up. So, it is easy for them to adapt to the changes. Adhe madri, and the hormone replacement therapy is usually given only up to 50. In a 50 kapra, you are almost coming to the natural age of menopause. And women who feel that, the hormone is so good for them that they don't want to come off it. Then I have to say, no, ma'am, it is high time, you need to come off it. Now, that's when we talk about hormones and the risks of breast cancer. So, whenever I talk about hormones, everybody is like, oh, cancer, enakku venda. But what I would suggest is, at least listen out with your gynae, listen to what he or she has to say. Not all hormones will cause cancer. Cancer, the menopause, there is endometrial cancer, that is uterus cancer, ovarian cancer, breast cancer. In the moon cancer, predominantly you have to think about. So, breast cancer, it is usually linked to, if somebody got a family history or high risk factors. If they hormone support for somebody has got menopause from since 40 years and 5 varsham 10 varsham avana eduthuvaana, then we will recommend that, okay, the mammogram eduthuko, which is one routine screening to check for any breast lumps. So, so when you are in the perimenopause, you've got to have one mammogram at least as a baseline. Because menopause aanapro, the breast will also shrink. Some lumps will become more predominant. Then women tend to worry, oh, breast lump means cancer. It doesn't mean like that. Not all lumps. In fact, majority of the lumps in the breast are benign. Very few. And mammogram is excellent in diagnosing those. So, adinala, nichama, around age 45 onwards, nichama mammogram pananam. Next cancer that we talk about is cervical cancer. Cervical cancer is one of the best cancer in terms of diagnosis, because நம்மள்ட்ட நிறைய screening techniques இருக்கு. So, the pap smear பண்றோம். அது you can do it once in every 3 years. That is more than enough. Till the age of 65 is more than enough, because beyond that we hardly ever see cervical cancer. Of course, if you are having it done as a part of health check, yes, you can do it as anti-aging, but the risk of developing one is very, very low. Ovarian cancer. Again, ovarian cancer is usually seen as, women who have got some family background, or there are some genetic conditions, history of colon cancer, breast cancer. They all come as a BRCA gene condition. So, the only thing with ovarian cancer is we are unable to diagnose till it is very, very late. That is one sad thing about ovarian cancer. But sadly, we cannot recommend everybody to just keep having an ultrasound just left, right, and center. So, if somebody has got any high risk factors, in the screening for ovarian cancer, we actually suggest, and that is also with some blood tests if there's a very strong family history. And avlo strong family history, if there are cases, we will actually say, just get your ovaries removed at the age of 45. And that is just because the risk is so high. For them, we'll say better to remove your, ovaries. And that is one person like that is Angelina Jolie, who got both her breasts and ovaries removed because there was very high risk of her developing cancers in them. Now, what I would say is that somebody's posted a question: should we be visiting? Should we be visiting a gynae for a non-troublesome menopause? Does it help for any preventive measures? Most importantly, accept the changes. and tell everybody in your family that I am like this because of these kind of physical changes that is going on. And please bear with me so that there are less flare-ups in the family. Awareness is the single most important thing. Awareness for your own self is important because you know that at least nothing is majorly wrong with yourself. Again, you can adapt your own, mechanisms to try and cope with it. Adile for yoga, meditation, exercise, being a lot more careful about what you eat and the way you eat. Now, the other thing is supplementation. So, sorry, okay, now I've told you about hormones. Calcium எடுத்துக்கிட்டா வேண்டாமா, vitamin supplement எடுத்துக்கிட்டா வேண்டாமா, அப்படி கேட்டா நான் வந்து I've already told you bone loss is happening. So in the bone loss, and how do I prevent or what can I do to reduce this abdina? There is nothing you can do to reduce the effects of menopause like for life, but you can make it easier on the system. So that's where you can take calcium supplements. Now calcium usually you take up to 1 gram every day, but there are women who say, now can I get calcium through milk? Can I get it through vegetables? Yes, you can, but that should be supplementary because I cannot say go eat, ஒரு நாளைக்கு 1/2 kilo broccoli தின்னு அப்பதான் உனக்கு, you will have enough calcium for the day. It is not possible. But you can say eat 2.5 cups of vegetables every day. So it will give you all the minerals and nutrients that you need. And you sometimes for vegetarians, B12 is often known to be deficient. In those conditions, we'll say, yes, please do take vitamin supplements. There is no harm in taking them. Similarly, calcium you take, but you also take vitamin D. We see that we ask 10 people to do vitamin D levels. 9 out of 10 will have very low levels of vitamin D. So sometimes I really have to ask myself, is there a point in testing for vitamin D? And if you have deficiency of vitamin D, you're taking calcium is useless because vitamin D is the actual channel through which calcium is absorbed by the body. Therefore, calcium சாப்பிடுறதுக்கு முன்னாடி vitamin D normal இருக்கான்னு பார்ப்போம். So please do take vitamin D and calcium supplements. And vitamin D, actually, you don't have to keep on taking it. You can, once you have taken a course, that is usually what we give is 60,000 units once a week for 6 weeks. அதுக்கப்புறம் மாசம் மாசம் ஒரே ஒரு டேப்லெட் சாப்பிட்டா போதும். And that should keep you in good health. So, there's one more question. Can estrogen supplements and vitamin supplements be taken over the counter and had for relieving menopause troubles? If you want to see, there are some tablets which have got plant-based estrogen. Phytoestrogens is what we call them. Yes, you can take them, but adila problem enna we cannot quantify. So for your particular condition, say for instance, ஒரு டேப்லெட் சாப்பிட்டா சரியா இருக்குமா, 2 டேப்லெட் கொடுத்தா சரியா இருக்குமாங்கிறது quantification is very hard. And அதோட absorption also is erratic. ஒரு நாளைக்கு சாப்பிட்டா ஃபுல்லா அப்சார்ப் ஆகும், இன்னொரு நாள் it may have some differences over absorption. So effect கன்சிஸ்டன்ட்டா வராது. சில பேருக்கு it suits, ட்ரை பண்ணி பார்த்துக்கோ, உனக்கு ஓகேவா இருந்தா you can try 3 months அப்படின்னு சொல்லுவோம். But it is not evidence based. So I can't kind of say, okay, take this particular brand and you're going to be fine. And these kind of things, trial and error la dhaan solluvom. And I won't really vouch for these medications because I would say in simple terms, they are like kalapadam. Enna adha irukkumne theriyadu. So I really don't encourage these kind of over the count estrogen supplements. Baaki multivitamins, usually they are okay. Okay, there's one more. I did a mammogram before 10 days, detected a cyst in the right breast and taking Liso for 600 for 10 days. Is it enough or should I? Okay. FNAC test, please guide. I'm 45, I have irregular periods from 1 year. Okay. One thing I'll be very honest with you. I'm a gynecologist and therefore usually the breast and anything to do with the breast is into a completely new specialty, and we have a lot of breast surgeons and oncologists to deal with the same. So if somebody has looked at your scan and has recommended an FNAC, then that means they want to reassure you and themselves that they are not missing out anything. Plus, without having a background of what was the cyst there before, is changes in the cyst, it is very difficult to advise as to whether this is going to be enough or not. So I think you will have to listen to whatever your breast surgeon has to say. And and again with that, it is just natural that a lady comes to us for a breast examination and we get a mammogram done. However, whenever you have any breast issues, it is a separate specialty. Gynecologists are not breast surgeons. So please don't just take your, okay, I will not go on the Urukapudal. If your gynecologist thinks you really need referral further onwards, then you have to go to a breast surgeon, male or female, and get it sorted. Okay, so I would like to just conclude my talk, and I hope I have given you enough information about menopause. Yes, I'm sure that there will be more, thoughts and things, and you will start Googling a little bit if it is affecting you at this point in time. But see, once you know what you're going to go through, prepare yourself for it. It is not that hard, to be honest, and it moves very quickly. So if you require help in whatever form or manner, please do speak to your gynecologist. There are lots of modalities of help available. So please seek help when you feel the need. And no question is silly. You must ask. At the most, the doctor is going to say, look, this is what the problem is, do this. Or they'll say, no, nothing to worry, and they will reassure you. So, anything else anybody would like to? Otherwise, I would like to conclude my talk here. I've answered that. Yeah, I've answered that. Okay. See, for sleep, to get better sleep, what we have seen is that the best is actually doing, just a little bit change in lifestyle is what we have seen really helps people. That is inclusive of taking a warm bath in the night, going to sleep, taking a, warm milk with some, this mandipudi in it, all that helps. And switching off from screens at least 2.5 hours before going to bed. Trying to read a book also helps people to sleep better is what is known. So taking a sleeping pill and all is usually should not be the first resort at all, because we all know that once in a while if you have family issues and lot anxiety, it is okay. But otherwise they are addictive. So no, I will not recommend that. Natural coping mechanisms is what we must be trying first. Yeah, that's done. Okay, see, food wise, there is nothing that will bring control immediately. Okay, so சாப்பிடுறது பார்த்து சாப்பிடணும். There's nothing like இதை சாப்பிட்டா menopause ஈஸியா இருக்கும். See, we have typically people saying நான் எள்ளுருண்டை சாப்பிட்டேன் உடனே வந்துட்டு எனக்கு period, and actually it is more coincidental. எள்ளுருண்டை in itself, how much எள்ளுருண்டை can somebody eat to bring on period? It is purely coincidental that you happen to eat that and it came in 2-3 days time. So there is not such foods, because even if it is documented, you have to consume the foods in huge amounts. That is not natural. So that's that. How to support them? So as I said, if somebody, this is how to support a family member who is undergoing menopause. What can be done to ensure that the stress levels are reduced? First of all, to reassure them that this is not something disastrous. It is a passing phase, and it's like a river you are crossing, and you will be on the other side soon. So you need to reassure and support them. If it is very problematic, then yes, there are medicines available which can be prescribed to them. And that is what I would suggest. So you can speak to the gynecologist, and then we can give them the medicine that will elevate the kind of problem. Is it a good idea to surgically remove the uterus to overcome this perimenopause and erratic periods problem affecting life and wounds? Are good to put up with it? No, as I said, the uterus is the end organ. It is just the messenger. You are not going to gain anything by or lose anything by, The thing is, if you have period problems, you remove the uterus, you won't have periods anymore. But you see, there is a reason why an organ has been given in the body. Removing the organ needlessly will give you problems. Whether it is going to give you more relief or problems. That is the way a surgeon decides whether you are a candidate who needs to have this done or not. And that would be the same for all people on the other side also who are going to be on the table. Just because another menopause no, we are not understanding the problem. The problem is not the uterus, but it is just for the ovaries then were a hormone which you are used to for so long. And now that's coming out. So if you actually remove all of them, you will have sudden menopause. That is even more hard to cope with. Post a normal menopause, anything to be taken to care. Yeah, we went over that. Wounds. My elder sister gained so much of weight during menopause. Is menopause a cause? Yes. See, as I said, metabolism slowed down. So and plus there are a lot of changes in the lipid profile as well. So all the cholesterols will go up and down during menopause, and for the same amount, weight gain but at the time lifestyle change yes, that could be a cause. Often people will weigh hysterectomy. Now hysterectomy weight no, it is not that. That is because post hysterectomy there was no hormone, you went through menopause and that has brought the weight gain. Hysterectomy and ovary removal if you had done enough amount of exercise and cut on diet, cut on food, then you wouldn't see that much weight gain. But the problem is, everybody is counseled. Hysterectomy you take so much of bed rest, don't do this activity, don't do this, and you have actually made sure that that person has gained a lot of weight. So again, whenever we do major surgeries, there is some amount of time that is given for the body to recover. But following that, one has to actually attempt more than oneself to go back to the routine. The weight gain varamal. Can medications relieve symptoms of the menopause without side effects? Okay, this I went through. Okay. I think I've done all of these after that. Yeah. Okay. Fibrous food seems to help relieve symptoms. Is it true? Fibrous, many of, yes, if you reduce carbohydrates and take more fiber, it has known to make it easier because the digestive symptoms also seems to slow down. We've seen many people developing constipation. So I have seen, though, if you look into literature, there is not much evidence to say you increase fiber and suddenly menopause symptoms. No, it is easier on your system because when you eat more fiber, you are not eating that much fat. So you will not gain that much weight. It is easier on your body. Okay, yeah. Thank you very much. I think somebody else is still thank me. So yes, I would like to thank all of you for patient listening. And yes, I will share my details and they are available at Curi Hospital. Anybody who wants to talk more on a personal basis or got any concerns, please do contact Curi Hospital reception so you can get an appointment, with me to discuss your issues. Thank you so much. Thank you.
Thank you, ma'am, for enlightening us with knowledge and experience. Before ending this session, we would like to share about two of our Curie initiatives. Number one is a free kidney screening camp scheduled on March 10th of this month, that is by 10 a.m. There is a free kidney screening camp. And the second one is the Curie Wellness Program. It's being initiated by our hospital to help provide people live life healthier, happier, and productive. which we started today, and still people can come enroll and get benefit out of it. So there are two programs. First one is free kidney screening camp on March 10th. Yeah, this is the information about our free kidney screening camp on the World Kidney Day. That is the 10th March from 10 a.m. And second one is Curie Wellness Program. So you can register, like this program has been started today. It will be done on alternative days. That is Tuesday, Thursday and Friday, Thursday and Saturday, sorry. So one day is yoga, Zumba and fitness training. So you can participate and get benefit out of it. Thank you. We thank Ms. 𝐂𝐨𝐬𝐧𝐬𝐮 and board members of Rotary Club of Madras East to give us a wonderful platform to create awareness on this special day. Also, would like to thank the entire team to make this event a successful one. Thank you. Thank you.